Hello, everyone, and welcome to today's webinar, Behavior Management in Children with Traumatic Stress, led by UAMS Associate Professor and our best trainer, Dr. Glenn Mesman. My name is Anna Kate Bogards, and I'll be your webinar moderator for today. Before we get started, I wanted to let you know a little bit about the RBEST program and do some housekeeping announcements. Arkansas Building Effective Services for Trauma, or RBEST, is a state-funded program at the UAMS Psychiatric Research Institute. And our aim is to improve mental health services for children and families who have experienced trauma. We work closely with multiple partners to build a more trauma-informed state, and we're probably best known for providing training to mental health professionals on treatments that are effective with helping children and families recover from trauma. A few housekeeping announcements before we get started. So you are encouraged to ask questions throughout using the question box on the little right panel of the webinar. Type that in there, and then we will set some time aside at the end to get to your questions. Also, if you're interested in earning a CEU, make sure you stick around to the very end, and I'll give you some more instructions on how to obtain that. We are recording this webinar, which we'll upload to the RBEST YouTube channel. And we also have some previously recorded webinars up there, so feel free to check those out. Also, don't forget to check us out on our RBEST Facebook page and like us. We frequently post upcoming webinars, training opportunities, and other resources, so make sure you don't miss that. All right, so now I'm going to turn this over to Dr. Mesman and let him introduce himself.
Thank you so much for that nice introduction, Anna Kate. As she was saying, my name is Dr. Glenn Mesman. I am a licensed child and adolescent clinical psychologist at UAMS. My clinical practice is at the Child Study Center, which is an outpatient clinic for kids from birth through the age of 18, and it's located on the campus of the Children's Hospital. So our clinic's known for a lot of different things, but probably most well known for treating kids who've experienced trauma and as a result are exhibiting a lot of different types of traumatic stress symptoms. So that's largely what I do within my clinical practice is see children who've experienced trauma, and all of you out there that are in a mental health professional role, that when you see kids who've experienced trauma, there are a lot of different kind of presentations. There's a lot of different symptom clusters. But I know in my own practice, I feel like I commonly see behavioral difficulties in kids who've experienced trauma. Of course, they often have intrusive symptoms. There can be avoidance, also those alterations in mood and cognition. But I feel like I see a lot of those marked alterations in arousal and reactivity, those behavioral difficulties. So it's really important for all those who work with kids, particularly those who've experienced trauma, to be really good at using different behavioral principles, behavioral techniques to adjust and modify and really manage some of those behavioral difficulties, and really working with the caregiver to kind of see some positive changes in the children's behavior. So I think it's really important for us to have this type of presentation. Okay, we're going to move on to our first slide here. Okay, so what is behavior management? Successful behavior management of children and adolescents with challenging behavior, it does require the consistent use of a variety of methods implemented in a coordinated manner. And you can see I highlighted 3 different words and phrases. So first, consistent. This is one of the most important parts of behavior management, but I often find it's one of the most difficult aspects as well. We want to make sure that caregivers, when they're responding to their children, they're responding in the exact same way every single time. So we want consistency within a caregiver, but consistency across caregivers as well. We want a variety of methods to help manage a child's behavior. Often caregivers use punishment strategies like timeout, removal of privileges, maybe a spanking every once in a while as well, but they often miss some of the more kind of positive strategies like reinforcement strategies to increase desired behaviors, wanting to do things that really build a relationship to be stronger and learning to give effective commands. So we have both proactive and reactive strategies. Those proactive methods happen before the child's behavior, and we want to elicit more positive behaviors. And those reactive strategies are the things that parents and caregivers do after the child's behavior as a way to increase or decrease the likelihood of that behavior occurring again in the future underneath kind of the same context. And then also it's coordinated. The skills that are taught a lot of times in behavior management programs are, it's not really done in a haphazard way. The skills are developmental, they build upon each other. And we really want to build this strong relationship first between children and their caregivers, and then add some other behavior management strategies on top of it as well. So our goal is to really see a lot of really positive caregiver-child interactions. And these are some of the hallmarks of what positive caregiver-child interactions look like. We want to build this relationship first, because if caregivers and children have stronger relationships with one another, particularly from the child perspective, they're more likely to listen and mind and comply with their caregiver. So we want to increase the child's behavior by building relationships. These pro-social skills that we want to see more of are like social skills, sharing. We want to improve their mood and self-esteem, and just like I said, build that stronger relationship. And also, many caregivers report that they just don't enjoy spending much time with their children when there's a lot of behavioral difficulties. Every interaction they have is either neutral or even more negative. So we really want to try to increase the amount of positive interactions they have with one another as well. And then finally, monitoring the child's behavior is really important in responding in a way that is effective and rewarding. If you ask a caregiver or a parent how often they praise their child, most adults will say they praise their child a lot. But what we often find in our clinical practice that caregivers and parents do not praise at the rate or kind of the frequency in which they should, that really can kind of counteract some of the criticism or some of the negative interactions that have to happen as well. So this is kind of more.
Lynn, I'm sorry, I just wanted to interrupt for a second. There's several people saying they're having a hard time hearing you. I don't know if you can just speak closer to the mic or speak up a little bit.
I'm wearing a headset, so I guess I will speak as loudly as I can, because I can't get any closer to the headset than what I currently am now.
Okay, no problem.
Anna Kate, are you having a hard time hearing me?
I'm fine. So we'll see if this will work after now. I'll let you know if it continues to be a problem.
Okay, I'll do the best I can.
Thanks.
Okay, so these are hallmarks of positive caregiver-child interactions. So these are some hallmarks of more ineffective caregiver-child interactions. So these are kind of just the opposite of the positive parent-child interactions. It's when caregivers give unnecessary commands. So of course it's okay for caregivers to give commands periodically throughout the day when necessary, such as if a caregiver and child are walking along the side of the road or on a sidewalk. It's perfectly appropriate for the caregiver to give a command to hold, for the child to hold the caregiver's hand. That definitely should be happening. But we want to make sure that caregivers don't give too many commands. Also, caregivers frequently ask kids questions, lots and lots and lots of questions. Questions every once in a while, not a problem. However, if that's the primary way of responding, it's a really indirect way and not a very effective way. Of course, we need to ask questions every once in a while, such as if a kid comes into the room and they're kind of crying, it's perfectly appropriate for a caregiver to say, "Oh my gosh, what happened? Why are you crying?" So once again, we just want to be mindful of how often questions are happening. And this next one is really important. Unfortunately, caregivers frequently respond to negative attention-seeking behaviors from children, such as maybe whining or sassing or crying for no reason. But when they respond to that, sometimes what they do is accidentally reinforce it, and it actually maintains the behavior as well. And then the last one too, caregivers failing to notice and to positively respond to good behavior. We want to make sure that caregivers, quote unquote, catch their child being good and giving them praise whenever the child is doing something positive. And I think this next slide really kind of demonstrates what often happens. Oh, let's see if I can go back. Often happens when we have a child who maybe has some behavioral difficulties here. Let's say it's Dennis the Menace here. You know, he's a menace for a reason, yet he comes by that name honest. So it's Dennis the Menace, but he's just saying, my problem is I'm good, but no one's actually really watching me while I'm doing it. And he's in timeout in the corner there. the cat's maybe giving him a little side eye and saying, is he really actually doing good behavior? I bet Dennis the Menace is really doing good behavior sometimes. Caregivers just are not noticing enough. And that's what we often see with behavior problems. Caregivers really pay attention to all the negative behaviors kids do, fail to notice many of the positive things they're doing. So how do we really increase effective caregiver-child interactions? So we use something called the PRIDE skills in many behavior management programs. It's maybe not always called PRIDE, but they're similar skills. So I highlighted the words praise, reflect, imitate, describe, and enjoy. So the first letter of each of the words forms an acronym, PRIDE. So effective caregiver-child interactions are marked by praise. We want caregivers to praise their children when they are doing good behavior. And there's different types of praise. We have what we call labeled praise and unlabeled praise. An unlabeled praise is a compliment, but it's not very specific. It's something maybe more like, thank you. Versus a labeled praise is, thank you for sharing. So now that compliment is much more specific. The child knows why they're getting praised, and therefore it's easier for them to replicate that again in the future. But we want caregivers to praise their children for positive behaviors, more specifically to be using labeled praises. We also want caregivers to reflect their young children as well. And I should say, these are more strategies that are kind of from our young children and to kind of younger school age kids. I'll talk a little bit about some more effective caregiver-child interactions for teenagers. But reflecting is important as well. It's simply repeating back what the child says or paraphrasing it to them, such as if the child says, the train goes choo-choo, the caregiver says, the train goes choo-choo. It shows approval for the child's language. It shows they're listening and paying attention. And also it can really help with young kids if they have some language deficits or they're behind a little bit with some developmental milestones with their language, because you're creating a more language-enriched world for them. Imitating is another great skill. If you're playing together, the child is building a tower with Legos, the caregiver is going to be building the same thing, could be building a block out of, a tower out of the blocks. The kid has colored the sky blue, the caregiver is coloring the sky blue. Shows approval for the child's behavior and also helps ensure that the caregiver is playing at the correct developmental level for the child. Also describing. This is a great one if you're thinking about like a sports announcer. A sports announcer simply says what is happening, what play is happening and who is involved. Same thing with the caregiver and the child. The caregiver simply says what the kid is doing as they are doing it. You're pushing the train down the track. You put a marble down the marble run. Now you grabbed a yellow crayon. This helps organize the child's play, keep them focused on task. And then finally, we have enjoyment. This is a really important aspect as well, because it adds warmth and genuineness to the interaction as well. Enjoyment is demonstrated by both what the caregiver is saying, but also how they're saying it. Maybe there's enthusiasm or animation. There's a smile, a pat on the back, a hug, a high five. Those are nonverbal ways of showing enjoyment as well. So it's important not just what you say, but how you're saying it and other behaviors that go along with it as well. So once again, we want to use the PRIDE skills: praise, reflect, imitate, describe, and enjoy. That really helps create effective caregiver-child interactions that develop a stronger relationship together. And this is a really good kind of proactive strategy that hopefully will lead to more positive behavior from the child. Another effective caregiver-child interaction is, let's see here, there we go, is helping caregivers avoid giving attention to negative attention-seeking behaviors that the child is doing. Ignoring is an often underutilized way of managing a child's behavior, but really it can be incredibly effective. And really this should be done for minor disruptive behaviors, not things that are destructive and aggressive, not things that are unsafe. This is more for a kid who's just kind of whining, sassing, crying for no reason, maybe talking too loudly, maybe mildly aggressive play. But these are things that caregivers can ignore, because what they actually accidentally do sometimes is they reinforce the child's behavior by giving too much attention to it. If they get really upset and set a limit and saying, stop sassing, don't be so loud, just talk much quieter, you're giving a lot of attention. and many times that attention maintains that child's behavior. So ignoring is not letting a child just kind of get away with the behavior. Because I often hear that from caregivers, like, I need to set the limit because they need to know what they're doing is wrong. But many times kids are doing these behaviors because they want attention. So if a caregiver is actively ignoring that negative attention-seeking behavior that's smaller and disruptive, they're actually not giving the child what they want. And over time, if a caregiver is consistently ignoring, that child's disruptive, negative attention-seeking behavior will go away because they're not being reinforced through attention. It's also really important, though, if you're ignoring the negative attention-seeking behavior, be on the lookout for when something positive is happening. So if they're talking kind of loudly and the caregiver is ignoring, the minute they talk in a normal tone of voice, the caregiver should say, "Thank you so much for using your indoor voice." Or maybe if they're playing a little aggressively with their Legos, but then they start playing gently, a caregiver immediately says, "Thank you so much for playing so gently with your Legos. I really like it when you play gently." Here it's teaching the child negative behaviors don't get attention, positive behaviors do get attention. And whatever a caregiver is reinforcing, giving a lot of attention to, it's more likely for that behavior to continue to occur in the future. Okay. So other ways to have more effective caregiver-child interactions as well. We're going to talk in a few slides about how to set these kind of situations up to practice these skills. Because a lot of these pride skills and selective attention ignoring it's not automatic for a lot of caregivers. That's why they're maybe coming to you for treatment. So we want to practice using your pride skills, but also practice times of avoiding commands or avoiding questions or critical statements, because those are things that can detract from developing a stronger relationship together. Once again, it's perfectly acceptable to give commands and questions sometimes. We're going to talk about practicing of times when maybe you don't need to be as directive. So once again, avoiding commands, it helps caregivers to avoid overuse of unnecessary commands. A command is really just suggesting a child for something to do. And many times caregivers just give so many commands, like I said, when it's not very necessary. So we're going to set up practice times for them to follow the child's lead, not take away not take away the lead from the child. So it helps develop that relationship to be stronger. Also, we're going to set up a time for them to practice avoiding questions, because questions really, you communicate indirectly. Questions often interrupt the play and the interaction. They can also kind of indicate to the child that maybe the caregiver isn't really listening to them. And sometimes questions can demonstrate or indicate disapproval, such as, "Why are you coloring the tree yellow?" Maybe you're just wondering, but by asking it, it can kind of show or kind of indicate or suggest some disapproval as well. And then of course we want to avoid caregivers using critical statements to children. These 5 words often are critical statements: no, don't, stop, not, and quit. By using those, once again, they're critical, they're telling the child what not to do. It doesn't really tell them what to do. It draws attention to all the negative behaviors versus drawing attention to positive behaviors. And actually, if a lot of this is happening during limit setting, you're accidentally maybe rewarding or reinforcing negative behavior as well. So we want to have times throughout the day where a caregiver is practicing being less directive and following the child's lead. Because once again, this is all part of developing and building a stronger relationship between the caregiver and the child. This is a really, really good proactive strategy. More positive behavior is going to happen from the child if they have a stronger relationship with their caregiver. Okay, so once again, like I said, we're going to set up times to practice these skills, those pride skills, the selective attention, and avoiding the commands, the questions, and the criticism. So with young children, when I'm working with caregivers and they have young kids who have behavior problems, I tell them to set aside 5 minutes every day to spend time with their child in a one-on-one play-based interaction. We call it special time. And we want caregivers to bring out a few different types of toys. These are toys that are creative, construction toys, building toys. They don't have a lot of rules or activities that discourage conversation. We want this to be whatever the child is doing in their play, and most likely is going to be positive and pro-social. And you want this to be in a situation in the home where It's distraction-free. It's one-on-one. It's not the whole family together. So maybe it's in the kid's bedroom, or maybe it's at the kitchen table. And the caregiver just follows the child lead and play. They use their pride skills: praise, reflect, imitate, describe, and enjoy. Practice avoiding the commands, the questions, and the negative talk. They play alongside the child in more parallel play or interactive play. And once again, we want to really help the caregiver practice these skills, because 5 minutes a day, this is a high quality interaction. The quantity isn't a lot. Quality will always trump quantity. 5 minutes of a high quality interaction where you're focusing and using these pride skills and following the child's lead will do wonders in developing a stronger relationship between the caregiver and child. It doesn't need to be an hour. Sometimes caregivers say, well, we watched a movie together, but those aren't really very interactive. It's really passive. But they're like, we were together for 2 hours. I'd rather have them spend 5 minutes in a high quality interaction than 2 hours in a low quality. Once again, quality always trumps quantity. But we want to set up a time and practice these skills every day. So these are some good ways to develop the relationship between the caregiver and more of a young child to a younger school-age child. So effective caregiver-teen interactions can look pretty similar, but they're a little bit different as well. This is where the caregiver makes really positive comments or neutral descriptive comments with their teen. Often they just kind of join their teen in the activity that maybe they're already doing. If their teen is playing video games, maybe they'll come alongside them and play video games with them. Or if they're outside practicing hoops and shooting the basketball, the caregiver does the same thing. The teen is listening to music, maybe the caregiver joins them and wants to listen to music with them. And also, kind of like I said, just be really genuine, avoid being phony, be a reflective listener. So you're not going to just repeat what that teen says back to you. Like, that works well for a 3 or 4 or 5-year-old, doesn't go very well with a teen, because the teen would be like, why are you just repeating me? But you can be a reflective listener. That's good. Try to avoid asking a lot of questions or corrections or instructions, because sometimes they can be too directive or not judgmental. You're really just trying to build your relationship with the teenager by kind of just hanging out with them. And with a young kid, we often talk about 5 minutes. A teenager, you can maybe do up to 10 or 15 minutes a day, and just joining them in the activity they're already doing. Obviously, the adolescent chooses the activity, usually, like I said before, you just kind of join them. And many teens at first are like, what are you doing? Why are you hanging out with me? What's going on? But after a while, many teenagers may realize, like, oh, you're actually kind of interested in my music. You're interested in what I'm doing, and they're kind of surprised by those things. So the skills that are part of being an effective caregiver-teen interaction is similar to the child, but it's different in a little bit of a different way as well. But once again, this is a really good proactive strategy to eliciting positive behaviors, building stronger relationships with caregivers and their children, and the caregivers with their teens as well. Another excellent proactive strategy for eliciting positive behavior is learning how to give more effective commands. Often caregivers say their child or teen does not listen to them. And then I ask them, well, tell me, what are some commands that you give them? And they tell me, and then we start talking about how do we actually make those commands to be more effective? How are they more likely going to get the child to do what they want them to do? So there's different rules of giving effective commands. The first rule of giving an effective command is making sure the command is direct versus indirect. An indirect command implies that there's maybe a choice, such as, can you help me clean up? Can you is kind of like asking them more in the form of a question, and a child may say, no, I can't. What we'd rather say is, please help me pick up the toy. Therefore, it doesn't imply a choice. The caregiver is telling the child to do something they're not asking. And also, it's clear that the child is responsible for completing the task. So the caregiver says, please pick up the toy, so it's clear the child does it, versus the let's pick up the toys means that the child and caregiver does it together. Kids are really literal in their language, so we want to be really thoughtful, making sure that commands are direct. You're telling the child what to do, you're not asking, and it's clear that the child is the one that's responsible. We also want commands to be positively stated. What I mean by that is we're telling kids what to do versus what not to do. So you're telling them, please sit beside me versus stop running. If you tell a kid to stop running, they may start skipping, or they may start crawling, or maybe they're going to roll on the ground. Well, technically they're not running, but they're not still doing what the caregiver wants them to do. So tell them what to do versus what not to do. You're more likely to get a child to comply. Also, it's good to have commands be one at a time. If you give what we call multi-step commands, go upstairs, brush your teeth, take a shower, change into your pajamas, and sit on the bed until I'm ready to come upstairs and tuck you in. That is way too many commands for them to do. They have to remember every single step of that. And also, it's hard to know if the caregiver is trying to assess for compliance. If the kid did 2 out of the 4 things, did they comply? Kind of, but not really. So we want commands to be one at a time because it's easier for the child to follow, and it's easier for the caregiver to know if compliance has occurred. And also, we want commands to be specific. So often caregivers say commands like behave, watch out, settle down, be careful. Those are really vague commands. It's not really clear what the caregiver actually wants the child to do. And kids may be saying, I am behaving or I am being careful as they're standing on the table in the living room. Instead of saying be careful, say, please put your feet on the ground. So there it's very clear what the caregiver is telling the child to do. Also, we want commands to be developmentally appropriate, not appropriate for the chronological age, because many kids, especially those who have experienced trauma, may be developmentally younger. Because we know trauma, particularly if it's chronic trauma, disrupts the development of a child. So we got to be thoughtful, what's the developmental age versus the chronological age, and making sure that caregivers are giving commands to children that's appropriate for a developmental age. Often caregivers give commands to a child that it's not within their skill set, and it's not fair for them to be punished for that when they're not actually able to do that. We also want commands to be polite and respectful. Caregivers should give commands in a neutral tone of voice. So it teaches children to obey commands when they are being told in a polite and respectful way versus they only obey commands when caregivers are yelling or screaming. So we want to prevent this cycle of the caregiver having to yell and the child only complying with the caregiver yells. So if a caregiver gives the command in a polite and neutral tone of voice every single time, children are going to learn to mind and listen to that. And also that really kind of simulates what happens at school, because hopefully the kid is going to mind the teacher without the teacher having to yell as well. And also commands should only be given when necessary. Giving lots of commands increases frustration. And also caregivers need to follow through with praising the child or disciplining the child if a kid doesn't follow the command. And if they give tons of commands, they're going to spend all day long having to discipline them. So it's good to be thoughtful of, if it's easier for you to do it yourself as a caregiver, just go ahead and do it. Or if there's not enough time to follow through with a disciplinary kind of sequence, just you do it yourself or give the child a choice. So only give commands when necessary. So those were 2 large proactive strategies to hopefully elicit more positive behaviors out of children. Developing strong relationships by setting up special time, that one-on-one time where they're practicing pride skills and practicing times of not being directive and learning to use active ignoring or selective attention. That builds the relationship. That's one great proactive strategy. And then learning to give effective commands is another proactive strategy. For the rest of our time together, I'm going to talk more about reactive strategies. What are things that caregivers are doing after the child has already done the behavior that will reward the behavior, meaning that it's going to be more likely to occur again in the future underneath the same context, or they're going to do things that punish the behavior, meaning that they're going to decrease the likelihood the behavior will occur again in the future. So we're going to talk about reactive strategies. Once again, behaviors caregivers do after the child already exhibits the behavior. The first thing we're going to talk about is reinforcement. So here we are seeing a child doing positive behaviors. These are things that we want caregivers to do because we want to see more of this positive behavior again in the future. So reinforcement is a process in which a behavior is increased by the consequence that follows it. So if a child is gentle or engaging in turn taking or sharing or follows a command, we want caregivers to use reinforcement because we want more of that in the future. There's a couple different factors that it's important to consider when we're thinking about reinforcement strategies. One, we want to make sure that the reinforcement occurs immediately after the behavior occurs or as close as possible in proximity to time. Because let's say we're using ice cream as a reward. I don't really suggest always using food as a reward, but I loved ice cream growing up. And I think ice cream was one of my rewards a lot of times. So I often have ice cream as a fallback for a reward. Let's say ice cream is the reward. And the kid actually does really well with getting ready for school in the morning. And then maybe dad says at dinner, you did such a great job getting ready this morning. Here, you can have ice cream for dessert. Well, that's a long time that has passed between the behavior and the reinforcer. And if we're talking about kids, particularly the younger the child, the more difficult it is for them to connect the reinforcer with the behavior. So it is best to give a reinforcer right after a behavior occurs, so they are pairing the behavior with reinforcement. The closer in time the reinforcer occurs, the stronger the effect. Also, when a child is learning a new behavior or engaging in really positive behavior, you want to give a reinforcer every single time the behavior occurs. So particularly if they're learning something new or they have not been sharing really well, but now they're sharing a lot, reinforce it every single time it happens. Also, we want to make sure that the children sometimes have little access to the reinforcer. So this is something if you're giving more like a tangible reward. Once again, we'll go back to the ice cream example. If I, as a child, only got ice cream as a reward after dinner, that seems to work okay. But if I had ice cream all throughout the day, now if I could eat ice cream whenever I wanted, it wouldn't really be a very, very big deal to me if I didn't have ice cream for dinner one night. Excuse me, after dinner, not for dinner. It wouldn't be a very big deal if for one night I did not have ice cream for dessert if I had access to it throughout the day. So you want to be mindful of how much access does the child have to the reinforcer, and you want to make sure the reinforcer is powerful enough. If I didn't like ice cream and you're trying to reward me with ice cream, I don't know what type of world that is where someone doesn't like ice cream though, but let's say that's possible, and you're using that as the reinforcer, but the child doesn't like ice cream, there's not really much incentive. That reinforcer isn't very powerful. So you want to make sure you're being really thoughtful as the kid is actually willing to work for that reinforcer. So praise is an excellent reinforcer to use. We want caregivers to use praise for everyday activities, such as compliance with commands or rules. So whenever your caregiver tells a child to do something and they do it, give lots of praise. Or maybe there's a rule of, maybe the rule is no eating in the living room and the kid did really good with not eating in the living room that day, give lots of praise for that. So we want praise to be used a lot throughout the day. And once again, in order to have praise be really effective, there's a few different things to think through. One I already talked about, we want praise to be labeled. Thank you for sharing versus unlabeled, which is just thank you. So we want to be mindful about that. We want praise to be labeled. Also, we want praise to be immediate. I already talked about that. We want the reinforcer. Here we're talking about praise to come right after the behavior happens. We want praise to be consistent. I talked about that as well. We want praise to be happening every single time the child does the behavior, particularly if it's a new behavior or they're just learning it. Also, not qualified. This is really important. So often a caregiver says, thank you for sharing. I wish you would share more often. Or that was nice of you to give the toy to your sister. I wish you would give the toy to your sister more often. Stuff like that, that's a qualified labeled praise. Caregiver has just really undone a lot of the positive by qualifying it. And also praise needs to occur much more frequent and a much stronger intensity than whenever they engage in limit setting or criticism. So for every kind of limit setting or saying something negative to the child, I always think you need to have like 5 praises to counteract that. So we need to praise at a much higher level. And also we want kind of punishment to be more kind of neutral. We want praise to be more animated and more excited. So it's more reinforcing because there's a stronger intensity. So praise needs to be a lot more frequent and a much stronger intensity than when more limit setting occurs. So rewards are a little different than praise. We don't want to use rewards for most day-to-day situations. Like I said, for following commands or a rule in the house, we want to use praise. Rewards are for a more kind of special situation. such as maybe they are on a shopping trip with you and they went to the grocery store and they're at Kroger for a whole hour and they did really, really well. You reward them with maybe picking out a candy bar. My favorite is probably Snickers when they're in the aisle to check out. So that is a reward because that's kind of a special situation. Also, maybe the kid does their chores, but they also do their brother's chores. They went over and above. A reward would maybe be something appropriate for that because those are more kind of special situations. And rewards can really provide additional incentive to stimulate motivation in addition to using praise. We want praise to happen, and you're going to really pair praise a lot with giving these rewards too. But like I said, rewards sometimes are needed for these extra important or non-day-to-day situations. One of the best ways to use rewards is through something called the behavior chart. And I think this is one of the most common behavior management principles. And I know a lot of people get some type of training in their graduate programs if you're a mental health professional on how to develop a behavior chart. So I'm going to go through this pretty quickly because I think a lot of people are pretty familiar with behavior charts. But this is a really convenient way of managing rewards. It's visual, it's less abstract, it's really easy to see when a child has done the behavior and the reward that's happening. But really, behavior charts should be used as part of a larger overall behavior management plan. There's still going to be praise. There's maybe going to be some type of punishment. You're using selective attention or ignoring. The caregiver is still building that strong relationship. You're doing all of these things in conjunction together. And behavior charts can be used with kids as young as about 4 years of age, and you're using some different kind of stickers or stars to monitor the child's behavior. I'll have an example in a little bit of what a little very brief, easy to use behavior chart could look like. But when you're developing the behavior chart, you want to define behaviors that you want to increase. Let's say a child maybe is not very good at brushing their teeth. So you're going to maybe you're going to really define what that behavior is. It's brushing the teeth for 2 minutes following breakfast. There you've really operationally defined what that behavior is. You're going to make a chart, you're going to display it maybe on the fridge or on the wall or somewhere else in the house. And you're also going to create a menu of rewards. What are things that children can get on a daily basis? And what are things that children can get on a weekly basis for obtaining their goals? So and these do not need to be things that involve money. Many of the families we work with think like, this is expensive, I can't buy these things. I totally understand. Most rewards do not have to be monetary in value, such as it could be a small toy from a dollar store, but it could be something like you get to stay up 10 minutes later past your bedtime. That's great. Or you get to pick the dessert that we're going to have tonight for dinner. Or maybe you're going to have another book. Usually they read 2 books before going to bed, but now they get to choose a 3rd book, or there's like a different game they get to play with their caregiver. These are just extra things they get to do that don't necessarily involve money. So there's smaller rewards for the daily goals, but there's larger ones for the weekly ones, such as maybe they get to go somewhere with the caregiver, somewhere fun. Maybe they can go to a friend's house overnight. That was one of my favorite activities as a child, and it didn't cost any money. You could go to your friend's house on Friday or Saturday night, or you could have a friend come to your house. Maybe you can rent a video game or a movie or download something. And sometimes if they're school-age kids or adolescents, sometimes there's maybe like an allowance that can happen. But really, you can be really creative with thinking with weekly rewards. Do not always have to involve money either. You just kind of have to be creative. But daily rewards are a little bit smaller than the weekly rewards. Setting a goal is really important for success. If a child does not start earning rewards within the first few days, they're going to feel like, I can't do it, it's not worthwhile, I'm not ever achieving this. They're going to stop doing it altogether. So what you want to do, let's say if it's for the example of brushing your teeth for 2 minutes after breakfast, you want to first get a baseline. How often is the child actually doing that behavior right now? Let's say they do it 2 days a week. Your first goal is going to be then 3 days a week. And then you're going to gradually move that goal up. So we're going to use the shaping process here. So let's say it's 2 days. Now when the first goal is 3 days, once they are consistently attaining their goal of 3 days per week, then you move up to 4 days. Once they do that, then it's 5 days, then 6 days, then 7. So you work all your way up to 7. I often ask caregivers, like, what's your goal? What should we say? And they're like, we want them to brush their teeth every day. I agree that's a fantastic goal, but if they're only doing it 2 days a week, the first goal should not be 7 days a week. It should be 3 days, then 4, then 5, then 6, then 7, or working their way up. Because like I said, if the kid isn't being reinforced or having access to this reinforcer, whenever they engage this behavior within the first few days, it's not going to be effective. Okay. Okay, we want to explain the chart. Once again, once you developed it, you come up with the system, have the caregiver explain to the child what do they need to do to engage, what's their target behavior? Brushing your teeth for 2 minutes after breakfast, let's say. How are you going to keep track of it? Is it stickers? Is it stars? Once again, setting up your daily and weekly goals for the rewards. Also talk about when are you going to give out the rewards. Let the child also then choose what their daily and weekly reward is as well. And it's good to frequently talk about this behavior chart as well, such as at the dinner table. It's like, wow, you did really, really good with this behavior today. You're working your way up to getting your weekly reward. We only have 2 days left. If you do it one of the next 2 days, you're going to be able to get your weekly reward. So talk about it outside of the time of when you're just giving them the reward as well. That can really help kind of prompt that behavior. And then once again, giving rewards. Each time the child does the target behavior, once again, there's a star or a sticker in the box for that day. It's nice to do it really like immediately after the child does it. Like, wow, you brushed your teeth for 2 minutes. That's fantastic. Let's go to your star or sticker chart. What star do you want to put on there? Great, put that star on there. You really want to pair this with praise as well, because over time, you may have the caregiver actually stop doing the behavior chart, and you're hoping that the praise actually reinforces the child's behavior. So they're still motivated to do it just by the praise. So you may actually fade out use of the behavior management system, in this case, the behavior chart, but hopefully praise will still maintain it because that hopefully will be reinforcing as well. And there's actually no consequences for failing to do the behavior. Oh, they didn't do it, they just don't get their reward that day. There's not a consequence for that though. And then, like I said, you want to gradually adjust the goal. I already talked about that. And then I'm going to quickly, I'll show you the behavior management chart. I think it's on the next slide. Sorry, that got out of sequence a little bit. But behavior management charts, such as the chart we were just talking about, behavior chart can be done for kind of ages 4 and up. But by the time we get to around age 8, instead of using a behavior chart that has stickers or stars, you can use to what we call like more of a point system. It's really developed and managed in really the same way as a behavior chart. It's just that each behavior maybe has an assigned value, such as brushing your teeth, you get 5 points. Clearing the table after dinner is 10 points. Feeding the dogs is maybe 15 points. So now there's more different points that are assigned to each different behavior. And then each reward also has a different point value as well. So the children can save up their points to purchase different rewards for at the end of the day or at the end of the week. So often you have like keeping track of this with kind of like pencil and paper, because you have kind of deposits and withdrawals from this quote unquote bank. And you as the banker need to kind of keep track of the points earned and the points spent and the rewards that they're giving as well. And once again, you always want to praise when you're giving out the reward, because you want praise to really maintain this behavior over time. But once again, a point system can be really helpful as well, instead of stickers or stars, because sometimes that just, it's more abstract. So you want to make sure that school age kids have a good understanding of what these points actually mean, and they're connected to a different behavior that they're doing. And you can use these points to purchase different rewards. So point systems can be used as well. So this is the behavior chart I was alluding to. I'll have to remember for next time doing this presentation, just switch these 2 slides a little bit. But you can see with this behavior chart here, maybe for this kid, there was 2 things they were working on: making their bed and brushing their teeth. And you can see here the kid for making their bed, he got 5 stars this week and 4 stars for brushing his teeth. So there maybe would be different goals that were set to these. And maybe if the kid had to make the bed 5 times that week in order to get the weekly reward, he did it. But maybe if it was 5 times a week for brushing his teeth, but he did it 4, so he doesn't get his weekly reward for brushing his teeth. So once again, these are some strategies. These are reactive strategies. Praise and reinforcement increase the positive behaviors you want to see out of children. We also have punishment strategies. These are strategies that caregivers use to decrease the behavior. So a process in which a behavior is decreased by the consequence that follows it. And many of these factors that for punishment are similar to the reinforcement strategies as well. It's best for the punisher to occur immediately after the behavior happens. I've seen this a lot of maybe a kid gets in trouble from maybe dad in the morning, and he says, wait till your mom gets home from school. Wait till your mom gets home from work, and then you're gonna see that, and then she's gonna tell you what you did wrong, and you're really gonna be in trouble then. Well, the kid now maybe did something bad in the morning, maybe hit his sister, and then mom comes home from work at 5:30, and then mom has to discipline him. If this is a young child, the kid's gonna be like, why am I getting disciplined? This doesn't make sense to me. We want the punishment to occur as close in time and proximity to the behavior, because the closer it occurs in time, the stronger the effect. Once again, it's most effective if the punisher is given every time the behavior occurs. And also we want the punisher to be powerful enough as well. Let's say if the punishment is removing electronics, let's say it's like, oh, you lost access to your video game system, but the kid can still play some types of video games on its computer. That's not a really effective punisher because they still have access to it. So once again, we want it to occur immediately after, every time it occurs, and make sure that it is powerful enough as well as a punisher. These are some really important considerations though when using punishment. And once again, punishment strategies are going to be used as part of a larger behavior management system. You're not going to only have punishment. You're also going to do stuff to increase the positive behaviors. You're going to have that special time to strengthen relationship. You're going to give more effective commands. You're going to learn to ignore the minor disruptive behaviors. This is just one aspect of a larger system. Unfortunately, many caregivers, when they come in, they tend to rely a lot on punishment. Punishment does not really teach a child what to do. It may decrease an undesired behavior, but a desired behavior may not automatically occur and replace that. So just because maybe a kid gets a timeout for hitting his sister, and over time, timeout is effective, the kid no longer hits his sister, it doesn't mean that the kid is actually going to be nicer to his sister or share with his sister. He may just avoid her now. So punishment does not automatically lead to positive behaviors. Punishment can really create negative interactions. It can really disrupt the mood of the child. It can just lead to really lots of arguing and fighting and lots of negative affect. Punishment often leads to escape or avoidance as well. I think about this kind of with lying. I grew up, I had 3 siblings, so there was 4 of us. And my mom always said there was a 5th child. So let's say somebody broke a dish in the kitchen, and my mom comes in the kitchen and she said, who did it? Me, my brother, 2 brothers, and my sister. All of us said none of us did it. And my mom was like, okay, I guess the 5th child did it then, because none of us fessed up, because we all lied, because none of us wanted to get into trouble. So if a caregiver uses a lot of punishment strategies, we actually see a lot of lying that happens because the kid wants to avoid getting in trouble. Also, punishment can be really effective, but it then sometimes can be overused because it's negatively reinforcing to caregivers. Let's say if a kid is whining, and every time a kid whines, a caregiver spanks them. Over time, the kid may stop whining, so the caregiver is like, great, I should keep on spanking my child for whining because I know it's effective. It's negatively reinforcing because the spanking takes away the kid's whining, and it's reinforcing because the caregiver now is going to continue to engage in spanking. So often negative strategies get overused because they actually work and it reinforces the caregiver's behavior. Punishment tends to work best, once again, if it's used just a little with lots of positives. Like I said, it's part of a larger system. Short, mild punishment is best, and it really does need to fit with the development of the child as well. And you want to be mindful with some punishment things is, let's say a caregiver removes privileges. After a while, you may have removed every single privilege and there's nothing left to remove anymore. And the caregiver's like, now I don't know what to do. The kid's still not behaving better because you removed everything. And once again, a positive behavior just hasn't automatically happened. just because you remove privileges. And after a while, there's nothing left to remove. So those are some things to consider with punishment. I'm going to go through, we'll have about 5 minutes left and we'll save a little bit of time at the end for questions. Timeout. Timeout is a punishment strategy. Timeout, by definition, is a loss of access to all positive reinforcers for a brief period of time following a problem behavior. Lots of considerations with timeout. Timeout is most effective for kids between the ages of 2 and 7. By the time we get to school-age kids, timeout doesn't work as well. Kind of removal or restriction of privileges tends to have a more meaningful impact for school-age kids or adolescents. You want to be thinking about the function of the child's behavior. Let's say if the kid is at the dinner table and they do not want to eat maybe their peas, and a caregiver is like, fine, go to timeout because you're not eating your peas. The child may be like, great, I'd rather not be at the dinner table. A timeout is a better alternative to what's actually happening. So if the function of the behavior is to actually escape or avoid, timeout doesn't work as well because they already want to escape and avoid, and timeout is helping them escape and avoid that situation. So timeout tends to work much better for things such as breaking a rule or being aggressive or hitting or swearing or name calling versus escaping a situation. You've got to think about practicality as well. If you're going to have a chair, where is this chair going to be? How big is the chair going to be? Where are we going to make sure that we put it in the house so the child does not have access to any type of reinforcement? So you got to think about some practical considerations with timeout as well. When we're thinking about the length of timeout, once again, we're thinking more about 2 to 7-year-old kids. Some behavior management programs really focus on it should be 1 minute for every year old the child is. So for a 3-year-old, it's a 3-minute timeout, a 5-year-old, 5-minute timeout, something like that. Other behavior management programs, such as parent-child interaction therapy, just uses 3 minutes regardless of the child's age, as long as they're between the ages of 2 and 7. But it's long enough for the child to be removed from everything positive reinforcing that it's punishing enough. The issue with timeout is you also need to be thoughtful of what happens when a kid gets off the timeout chair. So some behavior management programs, such as parent-child interaction therapy, use what's called like a backup room, which is maybe just the child's bedroom or a spare room. The kid gets off the chair, then they have to go to this backup room for 1 minute. Once they're in the timeout room for the backup room for 1 minute, they go back to the timeout chair. Oops, they got off the chair, they go back to the backup room. The backup room is simply the consequence for getting off the chair. And if you do that repeatedly, the child eventually learns they just need to stay on the chair because otherwise they have to go to a different room for a little bit. And it actually takes a little bit at first, but kids quickly learn you need to stay on the chair. That's where the consistency comes in as well. But you have to be thoughtful, what's the plan for when the child gets off the chair? And also if the kid is in the timeout, quite often they're going to be saying things that are mean or hurtful or swearing or tantruming. It is really best to ignore all of those things as long as the child is not doing anything unsafe. Safety is paramount. We got to be really thoughtful about it, but most of the time kids are just saying things when they want the caregiver's attention. If the caregiver says, you got to be quiet, stop saying that, that's nice, that just reinforces the child's behavior and they're going to keep on doing it. So you want to avoid those interactions that they're those negative attention-seeking behaviors that they're doing in timeout. I do want to be really mindful about timeout for kids who've experienced trauma as well. Some people feel that timeout is re-traumatizing to them, but there's really no empirical evidence that suggests that timeout is a trauma. Like it's not the same type of thing that has happened to them, such as child abuse or neglect or a motor vehicle accident or separation from a caregiver. Timeout is very brief. After the timeout, you go back to building the relationship again. You've already spent so much time building this relationship to be stronger that timeout often goes easier because you already built a strong relationship together. For a lot of evidence-based training programs, such as parent-child interaction therapy, timeout is an important aspect of it. And there's really great research looking at timeout when part of a larger management program actually is effective in reducing symptoms of trauma. Great research. Kids have experienced trauma, gone through PCIT, trauma symptoms have gone down, and timeout was an integral aspect of it. So timeout can be an important aspect of a larger parent management system, behavior management system, and it's not re-traumatizing to the child. how timeout is looking, probably in the context of this system, it looks probably very different than timeout looked before for this child. And they're learning that they can be disciplined in a really safe, calm, predictable manner as well. So I do want to just briefly talk about how timeout can effectively be done for kids who've experienced trauma as well. And it's really effective in helping reducing some behavioral difficulties. And lastly, I want to just talk about a different type of strategy here as well, called response costs or restriction of privileges. So instead of timeout, there's removal of a specific amount of a reinforcer following a problem behavior. Once again, this is a reactive strategy. Child engaged in the problem behavior, you're going to try to decrease it through punishment. So once again, considerations here. This is best for kind of school-age kids and older. Like I said, timeout is better for some of those young kids, school-age. You can remove privileges. The reinforcer, removing it must be meaningful for the child. You have to think about how much of that or how long that activity or privilege is being removed. And you got to think about ethicality as well. You can't deprive children of basic necessities. You can't say, yo, you can't eat any food. No food today because you hate your sister. You got to be thoughtful about that. You can't just like, oh, you lost access to your bed, so you need to sleep on the floor, or you need to be outside. Like, clearly that's highly inappropriate. You got to think about basic necessities. You cannot deprive those. So different examples could be, if a kid swears, you put a quarter in the jar, or maybe it's $1. If they lie, then they have 30 minutes left of TV that day. Or if they were physically aggressive, there's no dessert for dinner. So once again, this is removing privileges for a brief period of time as a way to try to reduce the problem behavior. So that was a quick overview, whirlwind through different behavior management strategies that can be done to help behavioral difficulties in kids who've experienced trauma. Once again, we have those proactive strategies, developing a strong relationship, learning to give effective commands, ignoring minor disruptive behavior. That's part of those proactive strategies. And then the reactive strategies, the reinforcement, so praise or rewards, and then also punishment, such as timeout or response costs or restriction of privileges. So once again, that's a whirlwind tour. I believe you have access to all the slides I sent to Anna Kate, so I'm sure those are posted. So I know I went through it kind of quickly, but you should have access to the slides to use for the future as well. Anna Kate, what's up next? Are there any questions or anything that
I think we have just a few minutes for some questions. Thank you, Glenn. That was a really helpful, like you said, whirlwind overview.
Yeah.
There's more to be learned here, but we had a few questions come in. One person was wondering, and I know this could be a whole other talk, but for these strategies, are all of these for children with traumatic stress, or are there certain things that should be avoided?
So all of these can be done for kids who've experienced traumatic stress. All of these strategies are a part of like parent-child interaction therapy. A lot of people are trained in trauma-focused cognitive behavioral therapy. These are all aspects of trauma-focused cognitive behavioral therapy as well. So once again, you want to be thoughtful of maybe how they are done, but all of these can be done for kids who've experienced trauma, definitely. And like I said, a lot of research has gone into trauma programs that also are looking at how do they manage child behavior, and these are aspects of them.
Okay. And as far as doing psychoeducation with parents, is there some sort of video or a webinar like this that would help them understand these strategies better? Or is there anything you normally do with parents?
Oh my gosh, Anna Kate, are we trying to use our webinar as psychoeducational material for the whole state of Arkansas? Is that what this is? I love it. Use the webinar. Yes. No, that's a great idea. I think a lot of times you do have to provide psychoeducation on what are these strategies, why are we going to use them, what's the evidence base behind them, talk about strategies they've already used. So I think it is important before launching into more of a structured behavior management program. It is good to get at what are they doing, why are they doing it, what has been successful, what has not been as successful. And there's not as many kind of like resources that I often use, but I'm sure like American Academy of Pediatrics, I'm sure has some great resources. The CDC also, I'm sure has some great resources as well that are just more about behavior management. I have different kind of books and topics, parent-friendly ones that I sometimes recommend as well. For me, anything and I almost said Charles Barkley. Oh my gosh, Russell Barkley, not Charles Barkley. I think I said this before as well. Russell Barkley is someone who's really well known within the ADHD world and kind of behavior management. Anything from Russell Barkley is going to be a really great educational resource. There's just some parent-friendly books. Alan Kasdan has a really great behavior management program. So there's just lots of good parent management things that are out there as well. But like I said, American Academy of Pediatrics, the CDC, they're going to have some good resources as well.
Great.
I don't know if I would look at Charles Barkley though.
Well, thank you, Glenn. Dr. Mesman, this was very helpful. And I will, for those of you who are still listening, the webinar code is 2605. I will be sending out an email here shortly, and it will include a link that you can click and fill out a survey with that code, and then you should get your CEU. I will also include the slides, and if you have any further questions, feel free to ask those to me by email. So thank you, everybody, and we look forward to seeing you next time.